Today we're talking about Sbar. I is for identification, S is for situation, B is for background, A is for assessment, and R is for recommendation.
Hey Mike, I'm Catherine from 5B. We just brought down Miss Claire.
Oh yeah.
So I wanted to give you a report real quick, okay?
All right, sounds good.
While we're talking, your charge nurse is already in the room. Miss Claire's oxygen is up and running, and she's getting all her monitoring set up. So Miss Claire first came to us for some shortness of breath, and it was really only a couple of hours ago. She got up to the bathroom and just became suddenly much worse. Rapid breathing, her oxygen saturation went down to 86%, and she just, started to feel kind of panicky and started to look cyanotic. In the past half an hour or so, we've increased her oxygen from 2 liters to a Venturi mask at 40% just to keep her sats about 89%. I've just gotten a call from lab that her D-dimer is elevated. We did draw a full lab panel, but I don't have the results yet.
She has a history of clots?
Not to my knowledge.
Okay.
She also has a history of mild asthma and had a surgery to remove a melanoma tumor. She was admitted last shift for just fatigue, palpitations, intermittent dizziness. She did get an injection of enoxaparin, but it was just low dose prophylactic. Her sister was staying with her, but she had to leave at shift change to get to work. We suspect a pulmonary embolus due to her symptoms. She does have a history of birth control use, actually, so maybe that's part of it. And that's been for 15 years, she said.
Okay, huge risk factor for sure.
Right. Her O2 sat is about, 89, sometimes 92% on that Venturi. Respirations are 28 to 32 a minute. Pulse is 136. So she could definitely be handling it better, but she's still on sinus tac. BP is 94 over 58, and her temperature was 99.4, and that's the first temperature that she's run of any kind. Lungs were clear at change of shift, but now she's starting to have a non-productive cough, and her lung sounds are diminished. She started to have chest pain and anxiety again during transport. Her peripheral IV is saline locked in the left form, and it's an 18 gauge.
Got it. Did we ever do an EKG for the chest pain, or?
They did an EKG when she came in through the ER.
Okay.
But we haven't done one since. We've just been trying to get her airway secured.
Everything was negative on the EKG?
It was.
Okay.
Her potassium was on the high end of normal on admission, but we didn't have to treat it. It wasn't out of range. So you may want to look at that when her labs first come back. I have a verbal order for you for the heparin drip that she'll need. I've just placed the order, but wanted to get the doctor to sign off on it before we did the bolus or actually hung the drip, and he's supposed to be right behind me. So he was coming down the elevator. You'll want to start a second IV as soon as possible. Dr. Meadows said as soon as the heparin drip is started and her oxygenation is stable, she'll have to go to CT, of course, to rule out the PE. Her last creatinine is 1, so you should be good to go ahead with any IV contrast that they need. Nice. I'll go ahead and call her sister so she knows her new room number and the situation too. Is there anything that I can answer? Do you have any questions for me?
Do you know if she has an allergy to contrast dye or iodine?
She reported only an allergy to penicillin.
Okay.
And bee stings.
Okay. Cool. And then her medications are in the MAR, correct?
They are.
Okay.
And it's so early in the shift, she really hasn't had any of those yet.
Got it. Okay. Fantastic. Well, thanks so much, Kat. Appreciate it.